Guys, I'm just going to record two important reading questions from authentic material. Thanks to Cambridge and E2 Language for preparing this wonderful question paper. But again, being Dr. BKM Institutes, my job is to tell you the solutions, that how do you act in the final exam, how your mind should work. This is what I always call as elimination method. Uh, I'm just going to read a paragraph, then we will solve two questions, which we have already done. But for you guys, for the recording, I'm doing it again. Yeah, see, read this. I will read everything because we have already read it, and I will read it little fast because you have the recording. You can listen to it again and again. Migraine is often thought as an occasional headache, but surely symptoms such as these should tell you that there is more to it than meets the eye. What do you mean by this thing? Otherwise, there is no question from this line. But I am telling you, in the final exam, suppose if you get this question only, what do you mean by meets the eye? If I tell you more than what meets the eye means beyond the eyes. Beyond the eyes means it is beyond the thing that is appearing to you. Meets the eye also means appear. Anything that meets the eye means it is appearing. So even the word more to it than meets the eye also means beyond appearance, beyond what it appears to be. Beyond always means more than. So beyond is a very good word that you should know. Beyond means more than that. Okay, but yeah, in this our question is not so. But again, you should know how to read. So now this. In fact, many scientists now consider it as a serious neurological. One of the research into the migraine aura has looked. Again, they are using present perfect. Has looked at the phenomenon known as CST, a storm of neural activity that passes in the wave across the brain surface. So it passes as a wave across the brain surface. First seen in 1944, the brain of a rabbit, it is known that CSD can be triggered when the normal flow of the electric currents within and around the cell is somehow reversed. So there is a normal electric current in our brain, but when it is reversed, CSD happens. What is CSD? It's kind of cortical spreading depression. Cortex spreading depression. Okay. And what is CSD? It's a storm of neural activity, and it is a reversal of neural activity. Okay. Now NH. These are the lines where the question is from. If it is my final exam, first I will read the question, then I will read the paragraph. So when I will read the question, then I will understand there is nothing from this. Because my question is from NH. NH means the name of the scientist. NH and her team at the Harvard School managed to record an episode of CSD in a brain scanner during the migraine. So during migraine aura means when the migraine aura was happening, they managed to record CSD. That means they were happening together. In a visual region that responds to flickering motion, having found a patient who had the rare ability to be able to predict when aura would. So it is in the patient who had the rare ability to predict the aura. So what she did and her team, she recorded an episode of CSD during an aura for the patient who had the rare ability to predict when an aura would happen. This confirmed, this over here means either the rare ability or this means this episode, the recording of this can be means the recording of the episode when two things are happening together. This confirmed a long suspected link between CSD and aura. Now he's talking about CSD and aura. That means he's talking about the episode where CSD and aura were recorded together. So that is why you can find the connection, because they are happening together. That often precedes the migraine pain. Pre means always before. That means it is happening before the migraine pain. There is an aura. There is CSD. NH admits, however, that other work she has done suggests that CSD may occur all over the brain. So she could record the episode only in the particular area, in the visual region. But she also admit that though I have recorded aura and CSD together, but I also want to tell you that CSD may occur all over the brain, often unnoticed, may even happen in healthy brains. So now may means that she is not sure about anything. If so, aura may be the results of person brain being more sensitive to CSD. So that means she says that CSD happens all over the brain, often unnoticed. That means it may happen anytime. But aura means the thing that happens before the migraine. The aura happens only in the migraine brains. Means but migraine brains are more sensitive to this CSD. That is why aura happens. In the normal healthy brains, aura does not happen, but CSD happens. Means this wave keeps on passing, but body does not react to it. But in the case of migraine, body reacts. But according to the question, two words I want you to notice. May means she doesn't know what surely happens. So there is no definite conclusion. And this means two things are happening at the same time. So when I will take you to the questions now, as we have just done these two questions, so now understand the elimination as well. So in the final exam, there is no word like theory. There is no theory. This means this means the theory that connects CSD and aura. First of all, you need to understand the meaning of this. This means always when they say this means you have to find the answer in a line before. So there was no theory in this. There was just the recording of an episode. They did not talk about any theory in this line. They just talked about the fact that she managed to record. There was no theory. It was a fact, it was a reality that she recorded. There was no theory. So you can eliminate this word very easily. Please understand. And in this question, I'm recording many things. Like because there would be many questions which comes on this when it comes to final OET exam. So I'm also talking about this as well. So this over here does not mean theory. The part of the brain, they were not talking about the part of the brain because they said this confirmed the link between CSD or aura. That means simultaneous. Simultaneous means co-occurrence, occurring together. So simultaneous occurrence of CSD or aura confirmed the link between long suspected link between CSD and aura. That is what we read. You can listen to the recording again. This will help you. So this became my answer. And in the D part, some people can do D, the ability to predict when. Please understand, rare word has been eliminated. In the paragraph, if you will go, rare word is given. So the main thing was that there was co-occurrence of CSD and aura that confirmed the long suspected link between CSD and aura. That was the line. Now, if you could see this, the previous question, maybe, then we did the previous question that the research by the NH into CSD has less relevance than means comparative degree. If you will see my other videos, THAN means comparative degree, means comparison, but there was no comparison. Less belief, before belief, did not result in definite conclusion. The presence of word may is the proof. If I say co-occurrence, then the word was during. That is why I recorded this video to tell you the importance of during, importance of may. That is what big exams are all about. They are not difficult. Was complicated by technical difficulties, overturned years of only answer can be this may. If you understand the may, that means it did not have a definite meaning. If you understand word during, that means they were occurring together. This is what basic English is. If you want to pass, you just need to notice this English. Sir, how would we notice? When you will listen to this video 3 times, I promise you will keep this video in your mind even when you will take your final exam. That I have to notice small words, I have to use elimination. Theory word, not given, part of the brain, not given, rare ability word, out. Overturned years of knowledge, no. Was complicated by technical difficulties, no. Comparison, not given. Your two difficult questions will become the easiest question of the world. And that is how in the final exam we will pass. Please, again, even if you can listen to this recording 5 times, that is up to you. But the more you will listen, the better it is for you. This is Dr. Bhupesh. Thank you from Dr. BK Institute.